Hi, I'm Carissa Trenton. I've been working with Family Service Regina in communications and fund development for 6 years. Family Service Regina is a nonprofit organization delivering programs and providing services for our community's most vulnerable and at risk. Among their programs, they offer mental health support through their long-term counseling program, as well as their Thrive Walk-in counseling program, which is offered at no cost. Today is Bell Let's Talk Day, and I'll be chatting with mental health professional Christine Andries. Christine has been working with Family Service Regina for 2 years. She holds her master's in social work and currently operates the Thrive Walk-in, Call-in, and Zoom-in counseling program. As a public service agency, it's imperative that we participate in ending the stigma surrounding mental health. We'll be chatting about the universal struggles that we've all been presented with during the COVID-19 pandemic. And I have no doubt that Christine will provide great insight into the everyday struggles that our community has been facing and provide some guidance and tools that we can all use to cope. So today is Bell Let's Talk Day, and I'm really excited to talk with you a little bit about mental health and the Thrive program that Family Service Regina offers. So can you tell me a little bit about what people need to know about Thrive?
Yeah, for sure. I've got my notes here because I am a little nervous anyway. Okay, so Thrive is this really great program because people can access counseling really quite quickly. I'd say within a day or two. And they get a free session. Sometimes all it takes is one session. They won't get advice. They'll get really good non-judgmental listening. I've had people say that it's really helpful to come to counseling because they get somebody who maybe doesn't overreact. Really working together to make changes. So if people are feeling a little bit down or a little bit anxious, they can come and talk to us. This is also really important is that we have 11 partner agencies or 10 partner agencies. Within the city, people can call Catholic Family Services. In Saskatoon, we partner with Family Services Saskatoon and CFS Saskatoon. And then there are services offering the same free single session or like walk-in counseling accessible in PA, the Battlefords, Melfort, Humboldt, Yorkton, Weyburn, Swift Current. And what's really cool is because they offer phone and Zoom, there's so many counselors that are really available for people to access counseling if they're feeling a little bit down.
And that's also free as well. That's no cost, 60-minute sessions.
Absolutely.
Great. Oh, that's awesome. So yeah. I'm kind of thinking because, we're in the middle of a global pandemic and it really doesn't look like the restrictions are going to be lifted anytime soon with the Premier's announcement yesterday. So how exactly, from your perspective, do pandemics affect our mental health?
So pandemics are so hard. We're noticing. I think it's so interesting talking about a pandemic because I think that so many people that I've been talking to for the last little while haven't even seen my face. Mm-hmm. So we've had sessions on the phone or always with a mask on. And so even the connection, I don't know that anybody would recognize me necessarily. So that's a real interesting thing that's happened with the pandemic. I think that the pandemic really keeps us from using our usual coping skills. So maybe we're really good at connecting with people and we can't do that the way that we're used to in a pandemic. We have to be really creative about that. Being out in public, so using public spaces, like if maybe we are not connected to people, but we kind of like being around people, like at the mall or different events, we can't do that so easily anymore. Mm-hmm. Even exercising the way that we like to exercise, it really has to change things. I think all of those things, and then plus there's this like steady level of threat, that there's something dangerous. So that gets people just feeling really intense, plus having to spend time maybe with people all of the time that we usually had breaks from. And now we see all of their intensities, right? Oh.
Yeah, even as a mom, I feel that. So how many people, like individuals, couples, families, do you see accessing the no-cost mental health supports at FSR compared to before the pandemic? Like, have those numbers grown, the people that are coming in?
Yeah, you'll probably see about, right now, we probably see about 20 to 25 individuals a week. we probably have room for about 30 per week. And prior to the pandemic, that number would have been a bit lower. So we are really filling up right now. But I think that people really can get in to see a counselor within 1 or 2 days, which is really awesome.
What kind of symptoms are people presenting with during the pandemic? Are they coming to you kind of looking for some support, struggling with some anxiety surrounding, what's been going on, or struggling with burnout or grief from the loss of a job or a loved one? What sort of issues do you see coming through the doors?
I would say that those are definitely things that we see. Interestingly, I would say that lots of people that come in don't voice the pandemic as their biggest concern. So the pandemic kind of like increases all of the feelings.
Mm-hmm.
So yeah, we see a lot of people with maybe like depression or anxiety symptoms. We see lots of intensity and kind of really noticing those body feelings, being really uncomfortable with that. Probably lots of people thinking, I don't think I can do it anymore, or like I'm feeling, yeah. I think anxiety feels really uncomfortable and brings up a lot of feelings from the past. So if we had any violence or intensity or unpredictability maybe when we're kids, and then pandemic is around, that really feels uncomfortable, and all those feelings kind of come up again. Yeah. So and then we see lots of different situations. So people having concerns with relationships. Sometimes people are feeling really, really down and like considering suicide, or that thought just kind of pops into their head, maybe not to stay, but like they are concerned by it. Yeah. Yep, so that's kind of some of the things that we see.
How do you think that people can monitor their mental health? Like, what would be healthy in this situation, and when should somebody kind of seek support?
Oh, that's a great question, Carissa. I think that we're always monitoring now during COVID. Hey, like we're always like, oh, am I okay? If we're really concerned about monitoring, or if we're kind of looking for that, and that can change so much in the course of a day. So there are apps. So one of the apps that I kind of let people know about is the MindShift app. That one's really neat, and it kind of monitors anxiety and gives us maybe some tools to use. People could use something like that. In session, I often ask people to do a real simple assessment to kind of rate their personally, relationships, and socially, to see kind of like which one do I need to pay attention to and kind of modify or switch. Mm-hmm. So even having like a check-in about that. Sometimes people monitor a little bit too much. And that can feel really uncomfortable. So just kind of know to take a break from it sometimes. But I think that you asked something really important about like, when do we need to worry about this, or when do I need to seek help? And I think that we really want to notice if behavior is really shifting. People are really kind of noticing and asking if we're okay. If there's any thoughts that are really like concerning, maybe thoughts about suicide, those are absolutely times that you can come and see a counselor, or seek help from those around you that are really supportive.
Yeah, exactly. I agree. That's awesome. Well, thank you, Christine. It was really nice to talk to you, and thanks for sharing a little bit about Thrive and mental health, and how to cope during the pandemic with people that follow our Facebook page. I'm sure that they're going to appreciate it, and they'll love to put face to the name now to those who have been talking with you and haven't been able to see you. So it was lovely to talk to you.
Oh, it's so fun, Carissa.
I'll talk to you soon.
You betcha. You have a good one.
You too. Bye.